Today, we're going to talk about something completely different, which is why can't you hold your breath for long? Now, if you've looked this topic before, you probably came across some answers explaining that the drop in saturation is what's causing it, or the increase in PCO2 is what's causing it. But the fact is, it's more complicated than that. Well, to start, it has been stated that it's practically impossible for a man at sea level to voluntarily hold his breath until he becomes unconscious, and there are several studies supporting that so far. In fact, even after the longest breath holds, subjects typically don't encounter any impairment in their cognitive function. Okay, before we start talking about factors that affect the duration of a breath hold, we have to understand a couple of things. There are two vital rhythms in all animals, which are the heart rhythm and the central respiratory rhythm. The heart rhythm is completely involuntary, meaning that we cannot control how fast or slow does our heart beat runs. But the question is the central respiratory rhythm something that we can control? Meaning that when we perform a breath hold, are we really suppressing the central respiratory rhythm, or are we merely pausing the respiratory muscles that contribute to breathing? Turns out during the breath hold, the central respiratory rhythm continues to fire signals to the muscles. However, we're voluntarily holding the muscles from continuing to breathe. Several factors have been examined to determine whether they have an impact on the duration of the breath hold. Some of those factors include the size of the chest, the level of the oxygen and carbon dioxide, as well as the potential role of the diaphragm. And I'm going to try to summarize some of those studies. One of the first things that researchers looked at was the size of the chest, because we know that breath hold durations are typically higher whenever you take a larger breath. So, does that have anything to do with the size of the chest? And is the slow consumption of oxygen leading to a decrease in the chest volume and subsequently leading to a breath hold termination at some point? Well, researchers looked at the breath hold duration of normal subjects and compared them to those who slowly exhaled during their breath holds and found no difference in the breath hold duration. Add to that the fact that if the breath hold duration is dependent on the lung volume, then that assumes that there's afferent nerves from the lung that send a signal to the central respiratory rhythm to dictate when to breathe. In another study that looked at the breath hold duration in normal subjects compared to those who had their vagus nerve cut bilaterally after a heart lung transplant, did not find any difference in the duration of the breath hold. So, again, suggesting that the size of the chest has nothing to do with the duration of the breath hold. Also, in patients who received T1 epidural anesthesia and therefore blocking all the afferent receptors from the intercostal nerves, did not have any increased duration of their breath hold compared to normal subjects. How about the effect of oxygen and carbon dioxide? Well, interestingly, at the break point, which is a point at which you no longer can hold your breath, the typical partial pressure of oxygen is around 62 millimeter mercury, while the typical partial pressure of CO2 is around 54 millimeters of mercury. These values are not outrageously high in the case of the PCO2 or low in the case of the PO2. However, one hypothesis would be that the break point, or the point at which you no longer can hold your breath, is when you reach a certain PaO2 or PCO2. So the hypothesis would suggest that if the PaO2 falls below a certain value or the PaCO2 rises above a certain value, that change in partial pressure would reach a threshold where the chemoreceptor stimulation would occur, and that would cause an involuntary breath. And this may be partially true. A study looking at the breath hold duration comparing hypocapnic patients after hyperventilation compared to normal capnic patients showed that there is definitely an increase in the breath hold duration in the cases of hyperventilation. Similarly, breath hold durations were noted to be almost doubled when subjects were breathing hyperoxic gas mixtures compared to air. But the interesting part is that the break point, or the point at which subjects started to start breathing again, did not happen at a certain PO2 threshold. It actually happened at a much higher PO2 levels of 533 millimeters mercury, which again argues against the theory that there is a certain threshold beyond which subjects have to start breathing again. And in humans, we know that the carotid bodies provide the only known means of detecting arterial hypoxia and of also assessing and rapidly detecting arterial hypercapnia. Another study looking at the breath hold duration, comparing subjects who had bilateral carotid artery body resection compared to normal subjects, and the mean breath hold duration on 100% oxygen was not statistically different between both subjects. But when assessing the breath hold duration on 21% oxygen, patients who had their carotid bodies denervated had a 54% longer duration of a breath hold compared to subjects who had an intact carotid body, which again tells us that there may be a role for the carotid body receptors, but it's not entirely the only and main reason for the duration of the breath hold. How about the role of the diaphragm in the duration of the breath hold? Where again, there was a study where subjects were injected local anesthesia into the phrenic nerves bilaterally, so therefore restricting the paralysis to the diaphragms and asking them to perform a breath hold. And the duration of the breath hold in patients who had the phrenic nerves injected with local anesthesia was almost double that compared to normal subjects, again suggesting that some of the breath hold duration is related to the potential role of the diaphragm. However, it's important to note that none of these subjects had their breath hold long enough to the point of unconsciousness, again suggesting that something else have led them to initiate that breath. To complicate things even further, certain studies looked at the breath hold duration with distraction or with performing mental arithmetics, and actually interestingly found that the breath hold duration was actually longer when you're distracted or when you're performing mental arithmetic. So, if we were to try to summarize this, I think it's safe to say that the breath hold duration is dictated by several factors. One of them is probably the amount of oxygen inhaled, the partial pressure of carbon dioxide, the role of the diaphragm, plus additional factors that we may not necessarily have a good grasp as far as how they affect the breath hold duration, which includes, again, distraction, probably the role of central chemoreceptors as well. But I think oversimplifying it into one particular aspect of any of these would probably be oversimplifying. If you like the contents of these videos, please take a moment to like the video, share it with your friends, and subscribe to the channel. Thank you.